A very good evening to you all, and thank you very much for joining us here on Rwanda Television. Now, let us start off with the first story. We're going to let you know that investment partners in the East African community affirms that an investment ameliorates. This is to go hand in hand with changing the lives of people. These were reiterated in the 5th annual CFA Investment Conference, and we have the reports courtesy of Prince Manzi.
And how this might impact.
Professionals in the field of finance and investors at large, decision makers in this field, entrepreneurs and experts, gathered in Kigali City to exchange ideas on investment in East African countries. The Minister of Finance and Economic Planning, Dr. Uzziel Ndagijimana, has assured that Rwanda will further expand cooperation with other countries in boosting investment in Africa.
The government of Rwanda is committed to fostering a conducive environment for investment and economic growth. We are ready to provide the necessary infrastructure, policy frameworks, and support mechanisms to facilitate investment initiatives central to the economic growth and of the entire East African region.
Kigali International Financial Center's Anita Mutesi elaborates that there's still scarcity in investment professionals.
Right now we're about 7 in the whole country, so that's a huge challenge. So how do we work towards creating a pool of professionals in this specific area of let's say investment? How do we make sure we have enough professionals to serve investors? How do we add more to the 7? I think around 2020 there were 3, but now we've increased to 7. So how do we even continuously add them? So bringing this conference to Rwanda.
Dr. Donald Kaberuka, the chairman of the South Group and former president of the African Development Bank Group, demonstrates that Africa needs a sustainable accessibility to finance in collaboration within nations through regions.
Attracting investment into a country is a means to an end. The end is the well-being of the people. It is not simply attracting factories or capital to do things you know very well. It's about the end of the day, will this make a difference in the lives of the people? So we have got many countries who attract huge amounts of investment, say in mining, or be it huge fixed capital somewhere. But if you look at the conditions of living of the people, all right, it has no correlation with the levels of investment.
Participants in the various discussions presented at the first annual CFA Investment Conference held in Rwanda pointed out that countries in the East African region should invest enough to enhance the knowledge used to analyze investment opportunities and to determine how investment is made. Prince Manzi, RwandaTV News.
Thank you, Prince Manzi, for that report. And now, according to the Global Financial Centers Index report, Rwanda was ranked the 2nd in the sub-Saharan Africa and 3rd in the whole of Africa, placing 67th globally. In an interview with Charlotte Uwase, the strategy and impact analyst of Rwanda Finance Limited, insights were shared about the report and how Kigali managed to achieve such a high ranking among the world's top financial hubs.
Financial Centers Index, it's an index that assesses the competitiveness of international financial centers globally. The index is prepared by a leading think tank based in the UK known as ZEDIA. So as Kigali is positioning itself as a preferred financial hub beyond Rwanda, Kigali joined the index in 2021 with an ambition to position itself as the best international financial center in Sub-Sahara, where we are currently ranked as the 2nd, and also ensure that we enhance our traction internationally.
Which are the criteria that these people who rank it? Which criteria do they actually consider rankings?
Yes, so the criteria are in 2 ways. The first assessment is done online. It's a survey done by international professionals where they rank Kigali against other international financial centers. The second way, or an assessment that is done, is done through an inclusion of Kigali in other international indices that are highly correlated with the Global Financial Centers Index. So in general, the international financial centers are assessed against 5 pillars. That we have skills, where Kigali is assessed against the skill level, the availability of skills and education. And then we have infrastructure, we look at ICT and transport. We look at business environment, which covers the rule of law and the regulatory environment in Kigali. And also we have financial sector development, which looks at capital availability, how easily startups can access capital. And also finally we have reputation, which looks at city appeal, how the city is perceived against the internationals.
Again, what are the current maybe developments that have backed Kigali to this place?
So the developments, we have mainly 2, where Kigali has improved its ranking through international recognition. And then the other development is the inclusion in the international indices that are highly correlated to the Global Financial Centers Index.
What are the benefits actually when it comes into this kind of ranking? What does it mean in terms of investment industry to Kigali, to Rwanda in general?
With Kigali positioning itself as a financial hub, being listed on this index is quite important. One reason, it creates awareness and visibility to the outside world beyond Rwanda and the region and the continent. So it has created awareness in terms of people are now getting to know what KFC is offering, the opportunities Rwanda is for offering in terms of the financial sector, and being able to allow international professionals to explore different opportunities that are being planned in Rwanda so far. There are different reforms through tax and regulatory and tax and capacity building that have been put in place to allow all these international professionals that will be keen to set up in Rwanda have an eye and interest to say, oh, this is Kigali, Kigali is doing this. So yeah, it's one of the ways that eventually we're hoping through all these implementations that are being done, it will allow to bring in more investments in the future.
Well, in terms of analysis, financial and actually investment-wise, Kigali, you still have very few professionals, those holders of CFA.
Yes.
What are the plans to keep Kigali actually more pushing up further in better positions in years to come?
Yes, correct. We're getting there. We still have few compared to the countries in the region, like Kenya or Uganda. But one of the ways we're doing, we're sensitizing young professionals to enroll and to promote more awareness among the young and also the university students, to entice them to take up these courses and also show them the incentives at the end of the day that are going to come out if they decide to take up these skills.
Students who have completed their studies at the Institute of Legal Practice and Development in Nyanza district of the Southern Province say they are confident that the knowledge they have acquired at the institution will help them to properly fulfill their responsibilities. They include students from all over the African continent.
My expectation, it was very good. It was very good. We had a very professional lecturers. They managed to train us very well. So now we are having skills in order to get involved in legal practice, whether to be a judge or paralegal or an advocate. I'm sure we have that skill. I will try my best in order to get a country in a right position. We often know that law, when there is a law in the country, that means that the country will go in the right direction. So I hope that one day I will be able to manage to get the country in the right position. I'm sure by now I'm 100% ready that I will be able to use the skill that I got here in Rwanda, in South Sudan, for the better legal justice of South Sudan.
A total of 362 students have been awarded certificates, 304 of them Rwandan, 34 from Cameroon, 17 from Gambia, 3 Kenyans, 1 Ugandan, and 1 South Sudanese. Stakeholders in the health sector have met to discuss the government's 4x4 reform that seeks to quadruple the number of people working in that sector over a period of just 4 years. The program would result in there being more than 48,000 employees in Rwanda's health sector, and measures to see this happen are already being implemented.
Talk of where we are today, there's been some progress. One example that we can give is the University of Rwanda that was traditionally enrolling 100 medical students per year. This year they enrolled 300 medical students. There's been the program of, for instance, midwifery, people that help mothers to give birth. We had traditionally a very low number of students in that field, but with partners we are able to enroll 1,500 midwives to start this program. So we are seeing some good progress in that area. We've launched so many new programs at the level of specialty care as well. It's going well. We've activated 10 teaching hospitals, new ones, across the country that are very well represented geographically. And these hospitals are becoming our training sites also to train doctors and nurses. So we're seeing good progress. It's only the first year, but we're sure, we're looking at the projection with the partners that we have here, both from government, development partners, private sector, that we are all working together to attain this goal. In healthcare workers, you're investing in the health of the communities, and this is aimed to have sustainable development, people that are healthy, that are productive, that make progress for their families, but for the country at large. And so you have that one pillar, which contributes to economic growth as well. The second thing is that you're combating diseases. If you look at the cases of death that we have, of all people that are sick, healthcare workers play a key role alongside other parts such as infrastructure. You've seen that we have expanded our number of health facilities, equipment, so that they take care of the patients. All these reforms are done simultaneously. We expect now people here in the country to live longer. You've seen that we have been able to reach 70 years of life expectancy. We want to push it further, to live longer but to also live healthy. Long life but also a healthy life. Decrease the disease burden, decrease mortality. And so just those are some of the outcomes, among others, that we expect to get out of this reform.
Still in the health sector, some of the challenges that still exist on the African continent include the lack of cancer data registry, the lack of research on this disease, and the lack of sufficient knowledge about it, including the fact that there are still few people treating this disease on the continent, and so on. In particular, the number of cancer doctors in Rwanda has increased from 3 in the past 5 years to 9 now. Dr. Maniragaba Theoneste, director of the cancer program at Rwanda Biomedical Center, reiterates to the strategies that are being enforced in Rwanda in order to continue the fight against this disease.
When we talk about healthcare that is accessible to everyone, it means that a person can access quality healthcare services. However, having access entails not only having doctors and getting medicine, but also having the necessary infrastructure. Currently, we have only one hospital in Rwanda that can provide both radiotherapy and chemotherapy, which is not sufficient for all Rwandans. We are envisioning how the University Teaching Hospital of Butare and Butaro Hospital can offer radiotherapy services so that people from the south and north can have access to these services without having to travel to Kigali. Additionally, there are concerns about the affordability of cancer treatment and how it can be covered by the community-based health insurance scheme, Mutuelle de Santé. Currently, most surgical procedures are covered by the community-based health insurance scheme, and the same applies to radiotherapy, although a 10% contribution is required. We will continue to discuss whether this contribution can be exempted. Furthermore, we are exploring ways to provide chemotherapy services under the community health insurance. Once finalized, we will inform people about these developments.
Without rapid interventions, the number of cancer deaths will increase from 520,348 in 2020 to 1 million in 2030 in sub-Saharan Africa. In Rwanda, in 2022, more than 5,000 cancer patients were diagnosed, of which approximately 500 had breast cancer, 500 had cervical cancer, and 300 to 400 prostate cancer. Statistics also show that in the year 2020, there were about 19.3 million new cancer cases worldwide. Cancer is the second leading cause of death in the world, accounting for an estimated 9.6 million deaths, or 1 in 6 deaths in 2020, according to the World Health Organization. BK Group plc has announced its audited financial results, reporting a net income of $59.1 million, an increase of 25% year-on-year, with a return on an average total assets and return on average total equity reaching 3.8% and 21.8% respectively for the period ended December 31st, 2023.
We're happy to confirm that BK Group remains the financial leading entity for 2023 on the market, and we are pleased to announce that we have a good performance for 2023 with recording a profit of 74.8 billion Rwandan francs, which is approximately $59 million, and which also translates to 25% growth year-on-year. We have also continued good records of return on equity and return on assets. And we have also been witnessing that all the BK's companies have recorded a good performance in growth, be it in revenues or in expansion. In particular, we're happy to see that with BK Capital, one thing we can share is that they have been arranging a successful issuance of BRD sustainability linked bond, which was something first of its kind, and being able to advise a significant amount of transactions, becoming a major player in the growth of the financial hub in Rwanda. For BKGI, among different activities we find in the press release, we're happy to see that they have been the lead provider in agricultural produce insurance with a growth of 33%. For the BK Tech House, I hope many know the payment gateways we have, but happy to see that like Urubuto has been growing for 166% in terms of volume transactions.
Total assets increased by 14.5% year-on-year to $1.7457 billion as of December 31st, 2023. Net loans and advances increased by 9.7% year-on-year. Client balances and deposits increased by 28%, and shareholders' equity increased by 14.8%.
For the first time, we are recording a profit before tax above the mark of 100 billion, at 109 billion, which is significant, and it's a growth of 23.8%. This is driven by a growth in our non-interest income, primarily, 34.8%. I believe this is very healthy because we've been trying over the years to diversify our income away from interest income. But interest income remains the driver of our income and grew by 20%.
Members of the Rwanda Federation of Transport Cooperatives, RFTC, have pointed out that the allowed dividend they have received has helped in the development of their livelihoods. Crystal Owase has more.
From the General Assembly that brought them together on Thursday, discussing the development of the RFTC they had in common, the members affirmed that they have been benefiting a lot.
This is the second time they have given us a dividend, and it's extremely exciting. We didn't know that good houses exist. We used to get milk from others, but now we are drinking milk and moving from one place to another anytime we want.
We are so proud of it. We are so proud of being member of cooperatives. We are very proud because from the beginning, members were not we are not aware of these activities, but now they are so grateful of it.
Retired Colonel Twahirwa Louis Dodo was re-elected to lead the RFTC. He announced that he's going to put more effort in the development of RFTC and its members.
I could say we achieved a lot, but we have to take care and manage all that we have achieved and put effort in supporting the development of our members. Secondly, we want our cooperatives, at least 50% of them, to be able to provide enough transport services in the country's different provinces, and I know that our cooperative members are ready to put effort and be more productive.
The Rwanda Cooperative Agency, RCA, commands the RFTC for its efforts to promote the development of its members, as it requires other public transport agencies to take this step and learn from RFTC.
You've seen that I was very happy as well as the members were. I was happy that they have received a dividend. I couldn't say it's a dividend only, but a bonus as well. That shows that all other cooperatives should learn from RFTC that at least each one of their members should gain a profit from what they invested.
The Rwanda Federation of Transport Cooperatives, RFTC, has 12 cooperatives that work all over the country with 1,285 members. They affirm that they are going to work together to further development of RFTC. Christelle Wase, RwandaTV News.
And on behalf of the news production team as well as the technical team, would like to thank you very much for sticking with us on RTV News. Stay safe and have a great night.